I want to talk to you all today about a change between the relationship of our practice and Delta Dental Insurance. And we know that there are many people in the Texarkana community with Delta Dental Insurance, and you will be impacted by this change. And I wanted to talk with you today by beginning to explain the reason for the change that's coming, and then talk about how that might affect our patients with Delta Dental Insurance, and then discuss some solutions we have for you all who would like to continue receiving treatment in our practice and utilize the benefits of your Delta Dental Insurance. To begin, this problem's been brewing for many years. I won't go into great detail about the dental insurance business, but Delta Dental separates the country into regions, and our region where we practice has not received an increase in reimbursement rates in over 17 years. And we've been continuing to absorb the increasing costs associated with practicing without any support from Delta. And over the years, we have regularly appealed to them to increase their reimbursement levels, and they simply will not do that. So we've been forced into a position where we must change our relationship with Delta. For instance, our colleagues in Arkansas receive almost 25% greater reimbursement than we do, and we're literally 1 mile from the state line. Yet Delta will not even consider raising their reimbursement rates to be compatible with our colleagues in Arkansas. So we are no longer going to be preferred providers for Delta Dental Insurance, and I'd like to explain how that might affect many of you. There are 5 doctors in our practice. Myself, Dr. Bunnell, has been here the longest, and I will no longer be a preferred provider for Delta Insurance. Dr. Duke and Dr. Legan will remain providers in our Paris location only and no longer be a provider in Texarkana, because believe it or not, Delta will pay the very same doctors doing this very same work in Paris 15% higher than they will pay us in Bowie County, and they will not negotiate. Dr. Burks and Dr. Hastings will remain as a preferred provider for Delta for the foreseeable future in both Texarkana and the Paris location. That situation will be evaluated on an annual basis. What does that mean to our valuable patients who have Delta Dental? Well, there's a couple of things you need to understand about Delta Dental to understand how this change will affect you. One component of dental insurance is assignment of benefits. And you may not be familiar with that term, but on your registration form in our office and the insurance claim form, there's a line where the patient can assign the insurance payment to the doctor, which means when you come have services in our office, we can calculate what the insurance benefit will be, and then you are just responsible for paying your portion of the fee. We subsequently will file a claim on your behalf, and Delta will send a check to our office to apply towards your bill. Almost every other insurance company in the country will allow you to assign benefits to the dentist, even if the dentist is not in their provider network. Delta will not do that. So if a non-participating doctor does your treatment, Delta will only send the check to the patient, regardless if you've assigned benefits to the dentist. That puts our office in the position of requiring every patient to pay their fee in full and then wait for insurance claim to be processed to receive reimbursement from Delta. And we understand what a significant financial hurdle that may create for many of our patients, and I'll discuss later a solution we have for that obstacle. But because that is how Delta handles their business, If a patient in our practice wants to continue to receive treatment by me, Dr. Duke, or Dr. Ligon in Texarkana, they will have to pay the surgical fee at the day the service is provided and wait for insurance reimbursement. If that's unsatisfactory, then they have the freedom to be treated by Dr. Hastings and Dr. Burks, who will continue to be providers in the Delta network. It'll be a seamless transition. Your chart's already in our office. We just assign you to a different doctor. For patients who still wish to see Dr. Duke and Dr. Ligon, they may do so, but they'll need to travel to our Paris office to receive treatment, because Delta determines reimbursement by the location where the treatment is received. It's not a difficult drive. We go over there 3 or 4 days a week to work in Paris. And if you really want to stay with Dr. Duke and Dr. Ligon, you may drive to Paris to receive treatment in our Paris location. Otherwise, patients who want to use their Delta insurance in our practice will be treated by Dr. Burks and Dr. Hastings, both of which are very competent, excellent people and excellent surgeons. So what solution do we have to offer for this onerous situation with Delta Dental? For those of you who want to be treated by myself, Dr. Duke, or Dr. Ligon in Texarkana location, we have an in-office financing program called Care Credit, which we've been using for many years. And Care Credit will extend credit to the patient for an interest-free period of time of 6 months, which allows you to finance part or all of your treatment costs without an out-of-pocket expense. With our electronic insurance claim filing, we'll still be able to file your insurance, and you will definitely receive your insurance reimbursement check long before the interest-free period expires, which then will allow you to pay off your portion of the fee just like you would otherwise. And this is our solution to overcome the obstacle of requiring you to pay the entire surgical fee on the day your treatment is received. I want you to know that this has been a very difficult decision for us to make, and we did not take it lightly. We were forced to make a decision between 2 alternatives. One would be create a tiered level of care in our practice, that is, have one level where we treat everybody at the highest level of treatment we could possibly do, which has been our mission from day one, and then have a lower tier for our Delta patients, which would involve using less expensive products, particularly our dental implant products. There are a lot of knockoff dental implants out there that can be obtained for a much lower fee. Sometimes that involves companies going out of business and no longer having components for implants, and a very poor level of support to the doctor, which translates to a poor level of support to the patient. And we're not interested in practicing 2 tiers of care in our practice. We've always been about being the very best we can be and providing the best treatment we can to all of our patients. So creating this 2 levels of care in our practice was very distasteful to us. We wish to treat everyone the same level of care that we provide to every patient. So we've had to make the decision to change our relationship with Delta Dental. It's been made in the context of trying to be the very best we can and provide the best care to every patient possible. And we hope you'll understand this situation, and our solution will help make the transition easier for you. My only suggestion is that when the open enrollment or your employment becomes available, you might choose to select a different dental insurance provider. Thank you for listening to me today, and I hope you'll continue to trust us with your care if you need oral surgery services in the future. Thanks.